Oh, she's so beautiful. All right, now that I've said those crazy lines and made myself look really crazy, I wish I had like a phone stand or something. I'll set my phone on my computer because that'll work for us here. So I'm doing patient care scenario. RJ is who I'll call the patient. And I'm actually going to just talk myself through this right now. So I get my patient care assignment. I see that I'm assigned RJ. RJ is a 20-year-old female, history of diabetes but well controlled since 12 years old. Diet is, of course, no concentrated sweets. Activity is bed rest, so the patient must use the bedpan, and we have to encourage her to do that. Her safety considerations are side rails upper, up ×2 at all times. The patient has a history of fall in the last 3 months. She fell off her bicycle. She's to have on non-skid socks, as are all of our patients, to prevent falls. She has allergies to sulfa that causes a rash if she has it, so I have to make sure that her medications don't have any sulfa derivatives or products there. I'm assigned comfort management for this patient. We're going to apply cold pack to surgical area 15 minutes one time. I'm also assigned fluid management, intake, output, and drainage device. She has a Jackson Pratt wound drain there. We're going to encourage oral fluid so she can have things by mouth. She also has parenteral IV solution lactated ringers. The flow rate is 125 milliliters per hour. It's an infusion control device. So that's important to note because we got to know how to do our calculations. I'm going to do medication administration, musculoskeletal management to her lower extremities, and then I will reposition her in bed once during the PCS with the help of another. She's assist of 2 when repositioning in bed, and I will active assist range of motion for her feet and ankles. I also have wound management for this young lady. I will cleanse her pin sites with 0.9% sodium chloride on a sterile cotton tipped applicator. So as I have that, she has hydrocodone with acetaminophen 5 and 500 milligrams every 4 to 6 hours as needed for leg pain. 5 out of 10 or greater. Her current pain level is at 4, so she won't have the hydrocodone at this time. We're just going to use some other comfort management techniques to help give this patient some comfort. She's ordered Keflex 500 milligram caps, 1 cap 3 times daily, so it looks like she'll probably be taking those at 8, 2, and 8. The time for her next Keflex will be 8 a.m., and I'll be administering that. And also she's going to have her birth control pills, ethanol estradiol, norethindrone at 8 a.m. She takes it 1 tablet daily to regulate her menstrual cycle. So that's like a routine medication that she takes even when she's not here in the hospital, so I will definitely make sure she gets that one. So now what I'm going to do, I have collected all of my data. I'm going to go down now, and so now it's time to do some really good acting. I'm going to pretend that I have the patient here and that I've already done her vital signs. So what I will do right now is I will record the vital signs. Now, I see here that she has, and I believe her diabetes is controlled with insulin. So I will administer her insulin. I don't see that here on the Mars. And I'm kind of like, okay, how could her blood glucose be high and she's not ordered insulin? And maybe I'm making a mistake. Maybe she's not supposed to have insulin, and maybe she's supposed to have oral medications, or maybe she's controlling her diabetes with diet. So what I'm going to do is I'm going to check her blood glucose, but prior to that, I need to find out, why is her blood glucose a little elevated? Maybe it's stress. Maybe she ate something that didn't agree with her diabetes, and we have to talk about that. And then I'm just trying to determine learner needs by seeing what I can do to teach this patient so that we can move her toward getting well. And as she wants to do, we can move her toward getting out of the bed. So without further ado, I'm going to introduce myself. So I'm going to wash my hands with soap and water. Soap, water. Happy birthday to ya, to ya. I'm not going to do this song in front of the CA because I don't think they're going to be impressed. I think they're probably going to be a little bit crabby. So I won't do that, but I'll do the song in my head. So we'll go for about 30 seconds. I'll wash my hands, scrub them down real good. Now I'm going to go into the room with the patient and I'm going to proceed to introduce myself. And first I would knock on the door and, hey, hi, this is Isra, I'm your new nurse for the day. Can I come in and talk with you? So, you know, naturally, I'm so charming that the patient will say yes. So I'll go in there with her, then introduce myself to her and let her know, hey, hi, RJ, I'm here to take care of you today. And today I'm gonna help you with comfort. I'm going to try to make sure you get enough to drink today. I do need to discuss your blood sugar with you because it was a little elevated at the last count, at the last evaluation. I do have some medications for you a little bit later on. But before I do that, I definitely want to get into taking a look at your pin sites. And I also want to help you get comfortable in bed. And I want to help you use the bedpan if you need it. But I do want to talk to you a little bit about your call bell, safety, things of that nature. Got to make sure you have your side rails up here ×2. And it's always nice to refer to your paperwork because here I am going off memory, which is never a good thing because you do tend to forget some things. But RJ, today I'm gonna help you by cleansing your pin sites, and I'm gonna help you get comfortable in bed. I will, as I said before, I will have some medications for you a little bit later. What I'd like to get started now is I'm going to take your vital signs. So you kind of can let me know if there's anything that, you know, you like to do differently than something that I might have planned. And just let me know, you know, pretty much whatever you need, I'm here for you. And I have some things that I'd also like to do. So what I'm going to do is first I'd like to confirm that your name is RJ. And RJ, if you can, I'd like you to tell me your date of birth. Okay, and I do have that date of birth, 10/20/84. And I'd also like you to let me look at your armband and see what your medical record number is. And I have medical record number 5518623456789101112131415. So, oh, awesome. So that matches. So that looks like I'm in the right room. So I think I'm off to a good start here. So after that, my plan of care that I developed, the assessments that I did are the temp is 98.6, and the blood glucose is elevated. It's at 140 and 100. The last checks before I came on that were reported to me were 98.2, so it looks like the temp has risen a little bit. Blood sugar is down a little bit, which is good. My NANDA 1 nursing diagnosis is risk for infection. Rationale for this is impaired skin integrity, and related factor is that she had a surgical procedure. Expected patient outcome is that the blood glucose will be between 80 and 120, and that no skin infection will occur. So that means that we'll have a normal temperature as we're getting off shift here and reporting on to the next shift. So we want to maintain her body temperature within normal ranges by encouraging fluids, encouraging her to keep those wounds clean, keeping her pain level down so that she can focus on the other things that she needs to focus on. So what I will do is, if she needs insulin, I will administer the insulin per sliding scale. But if she doesn't need insulin, then we'll discuss her diet, things to avoid, things to eat, that sort of a thing. So we can do some education based on that. And also, we're going to go ahead and cleanse the pin sites. We'll do some assessment with pain before we do that. And basically, we'll cleanse the pin sites to reduce the microorganisms on the skin surface and to maintain our skin integrity. So we want to keep the areas surrounding that wound looking healthy, clean, pink, not reddened, not crusty, not nasty. We want to keep it clean, and we want to keep it smelling good, and we want to keep it going in the right direction as far as healing so that we can get her up and get her out of bed. Our promotion of teamwork is going to be to reposition the patient in bed. That's going to be with the assist of myself and another staff member as well as the patient. So us three members will work together to make sure that we reposition the patient in bed so that she remains comfortable. So I'm going to take just a little sip of my tea. I won't be able to do this at the PCS, but I'm going to do it now on camera. I know it's bad girl. Psst. All right. So now, after I've developed my plan of care, the next thing I'm going to do is implement. So implementing would be to assess. And what I'm going to assess here, and I'm actually going to use note cards right now because I just want to make sure that I'm doing this right. And I'm actually doing this for myself later. So I kind of will start with, so plan of care I've already done because I've already created a plan of care. So safe patient environment is I did wash my hands before I went in to meet the patient and talk to her. Establish a therapeutic relationship. You know, hey, RJ, what would you prefer to be called? So I didn't ask the patient that, so that's one thing that I probably need to remember to do next time I introduce myself to the patient. I got to demonstrate my nursing judgment by providing consistent care, maintaining precautions, always washing my hands, using gloves if I'm going to be exposed, or if the patient is going to be exposed, protecting her, protecting me. Implement the nursing interventions right away, so just start like doing the things that I need to do for the patient. I'll communicate with the assigned nurse as immediately, like if something should happen to the patient or her condition should change, she's not stable. I will definitely make sure that, you know, I get the right staff people, because I'm a panicker. So at the end of the day, I'm going to make it happen. I'll respond promptly to clinical alarms. So I do teach the patient very much about using their call bell and calling us when they need help, especially when they're a bed rest patient. We do want to make sure that she doesn't have any more falls. We don't want her to get hurt any further. So maintaining patient safety is number one. So we always want to do that. I will always use proper technique to perform my interventions, making sure that, you know, I do use sterile tip cotton applicator as ordered for cleansing the pin sites, and that I keep my hands clean at all times. And even when I'm repositioning the patient, you know, that I protect her and that I protect me, use the proper body mechanics, and I'm always asking for assistance when I need it. And I will always act in a manner that prevents patient harm. So that's a good one. Maintaining a safe physical environment, keeping the room free of clutter, making sure there's nothing on the floors, so that I'm being also kind to my coworkers, you know, treating them well and keeping them healthy, so that there's no, you know, need for me to be doing all the work by myself, because I got people there who can work with me. We're always going to maintain the bed in low position, because again, we want to keep our patient as safe as possible. We don't want her to fall. If there's ever any chance that she could get out of bed for any reason, we, you know, don't want that trip to the floor to be too long a trip, because that's not a good trip to take. So we'll keep her call bell in reach, so she always has access to staff. That's kind of neglect if we don't make sure she has the call bell, so we got to make sure she has that call bell and make sure she knows how to use it. We'll keep the wheels locked at all times. Her upper side rails are to be up at all times, so those will always be up, unless we're providing care or something of that nature. I don't foresee that we'll need to put those down, because we can get vitals and all of those things while we have the side rails up. If we keep the bed in low position, sometimes we can raise it just a little to help, so you're not, you know, bending or using improper body mechanics. But other than that, we'll lower the bed in this case. For the infant stuff, we don't really need to do, because this is an adult we're dealing with here. And then we're just going to always act in a manner to prevent harm, always. We're going to maintain standard precautions. Again, you know, wearing gloves if we're going to be exposed to body fluids of any kind. Always washing our hands when entering a room, always cleaning them when leaving a room. Clean general use equipment, so that's the vital sign stuff. If we have like a machine or something, we'll clean it in accordance with the hospital policy. Use standard PPE, personal protective equipment when indicated. Like, so if we needed it, she was in an isolated room, we would have on our gowns or masks as needed. We don't need those at this time, so gloves are pretty much it. And we'll dispose of contaminated material in the appropriate container. So if we have like and I do anticipate that we probably will have like a bed, it's like an open diaper, you know what I'm talking about, but I gotta find a word for it. We put that, chucks, they used to call them back in the days. I don't know what they call them now. I need to find a name so I don't date myself, but yeah, we'll have chucks. We'll probably need to replace those, and if they have the cloth ones, we'll probably have to put them in a receptacle to be cleaned. So we'll always wash my hands with soap and water before going into a patient room, or once in the patient room and I've introduced myself and asked permission to come in, then I will wash my hands with soap and water. And then for comfort management, which is actually what I'm assigned with this patient, you know, I'll find out what she needs to learn. So kind of when I go into the room with her, you know, she says, "Oh, nurse, I feel so uncomfortable. You know, I gotta, you know, I don't like laying in this position, or I don't feel comfortable," what have you. I'll figure out how to help her to manage her own comfort. So I'll determine her needs based on, you know, our first discussions. And then I will ask her, absolutely just ask her, hey, you know, based on a scale of 0 to 10, using that comfort rating scale, which I don't happen to have in front of me right now, but I will use that and just ask her, hey, based on a scale of 0 to 10, you know, how comfortable are you, or how uncomfortable are you? And she can let me know what those numbers are. If it was a child, I would use comfort daisies, or observe their behavior. I'm always observing a patient behavior, so looking at facial grimacing. Is she sighing? Is she, you know, tearing her face up? Like, how does this person look? Are they tense? You know, are they relaxed? Are they cool? Are they easy? So you always do pay attention to facial expressions for patient. And then I will definitely get her take and her input on, you know, how she likes to become comfortable, like what helps her to get comfortable, what methods she's used in the past that have worked, and what kind of things she likes to do, so that I can implement those into whatever our routine is going to be, because it's always nice to have a patient who's cooperative, and they will be cooperative if they tell you things that they like to do. So going forward with the comfort management, with the implementation part of it, because this is where we are, I will provide education for her and let her know, hey, you know, RJ, when you need to move around in bed, you know, you have to get assistance, and to get assistance, you will use your call bell, and then we'll come and help you. Or if we're already here in the room, you just ask, and boom, we'll provide the service for you. So whatever you need, we're here for you. I'm going to provide the 2 interventions that I came up with. So I would like to so take her temperature, you know, make sure her temperature is good. Also, we'll check her blood glucose. Excuse me. And checking her blood glucose, and then talking to her about diet, you know, things to avoid. Don't eat like a fruit cup or something just by itself. You know, you need to balance your meals out. Avoid concentrated sweets. So that honey bun on your tray, it looks like they brought that in error. I'm going to take and get rid of that in my lunch bag. No, not really. I'm not going to, I promise not to put it in my lunch bag. So I'm going to get rid of this honey bun here. And, you know, what are you drinking there? Oh, okay, you've got milk. That's a good choice. We don't want to go with Kool-Aid or soda, or, you know, any fast food things. Family like to sometimes spoil you with fast food. We don't want them to bring those things in, because they're not good for your blood sugars, and your blood sugars have to be maintained, because if those are maintained, you're going to heal more quickly. And guess what happens when you heal more quickly? You get to get out of bed quickly. Yay! And you don't have to use the bedpan anymore. Lord knows we all hate rolling over onto that thing. So we're done with the bedpan. We're not going to really discuss the infant things because we don't need to do that. If there's other interventions, things she may need, then we'll do that to help with comfort. Sometimes, you know, patients like a good back rub or just like to be able to talk about things. Sometimes that helps them. You're going to feel isolated, especially when you're on bed rest. It's hard because you can't get out and get around to people. So definitely would do that. And then I will ask her some questions, you know, ask her to tell me, you know, how she can, going forward, how she can make sure she stays comfortable and the things she can do to prevent herself from getting infection, like staying hydrated, keeping her fluids, keeping her intake of fluids adequate, you know, using a call bell to call us so that she prevents herself from falling or getting further injured. So all those things to touch on with RJ would be good, and I would definitely do that. I will reassess and ask her, hey, you know, on a scale of 0 to 10, how you feeling? Are you feeling any better now that we've got you repositioned in bed and we've used extra pillows and we've got your, you know, made sure that you had enough water, made sure that you've had enough food, and made sure that, you know, your TV is on and your call bell's within reach. And as soon as she says, yay, we'll go with that. And so now comes documentation time. So I'm going to end this video right here, and I'm going to do my documentation. So excited I got through the first one. Yes. Yes.